Hey, this is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and I'm introducing my first segment of an educational series ongoing called Sketches to Surgery. I have this really cool desk in my office that doubles as a dry erase board, so I thought this would be a great tool to use for education of past clients, present clients, and future clients. And so in our first installment, we're going to focus on the guys, and we're going to talk about gynecomastia. We're going to talk about what it is, what the causes are, and the different presentations. So let's get right into it. Basically, the definition is an increase in the fat content and or the breast content. It gives a more feminine look to the breast, and for men, that is important not to have that look. They want to present in a masculine manner. What are the causes? There are three basic categories of causes. You can look on the internet and find maybe other causes, but these three are really tried and true. The first cause can be hormonal. It certainly can occur during puberty as a boy kind of goes into manhood. You have fluctuations in the levels of estrogen and testosterone, but at the end of that, you hope that you get those levels so that they are stable and appropriate, and then you end up with a masculine chest. Occasionally, those levels will kind of get to their point of stability, but you may be left with a presentation that represents gynecomastia. And so we'll talk a little bit about that, the presentations and the stages. The second cause can be medication. Certainly, medications that are used in mental health can cause gynecomastia. One that comes to mind is risperidol, and I've treated many clients with this issue. The last can be due to recreational drugs such as marijuana. So again, I've treated many clients who have had this association and gynecomastia, and we've treated them successfully. So those are the causes, and that's the definition. So there are many presentations to gynecomastia, and I've got them kind of represented numerically here, and I will draw them out so that you have a better understanding. This is our reference point. So this is the, I hate to use it, quote, normal chest, and that's usually kind of graded grade 1 and doesn't require any treatment. So we're going to talk about grade 2, grade 3, and grade 4. So with that being said, I'm going to try to zoom in. If it doesn't work, then I'll zoom back out and we'll draw and we'll talk a little bit. So here we go. And I'm going to reposition and I'll try to draw here. Okay. So grade 2 is a chest that looks masculine, but it has just a little bit of a peak. And I'm going to draw the nipple. And so you can see it's not as flat as this one, but it has a little bit of a peak. And it can be kind of look like a bodybuilder chest. I'm not saying bodybuilders have this, but it kind of has that shape. And this is a grade 2 presentation of gynecomastia. So what do you do for a grade 2? You can do lipo. And I typically go right here and take a little bit of the gland tissue out as well. So, but liposuction is a key component. And again, in subsequent videos, we'll delve into why and what types and all that stuff. But just as a general rule, liposuction can work really well for this. The next presentation is grade 3 or classification 3, and I'm going to draw it. These are somewhat exaggerated. And the nipple is here. So I didn't explain, but let me just jump back a little bit and I'll back out and then we'll get back to grade 3. This dotted purple line is basically a line that represents just the bottom edge of the chest muscle. If this were a woman, it would be the crease. It would be similar to the crease of the breast. And I'm just kind of drawing that out kind of in an imaginary line so that you can see the relationship between the nipple and the crease in each type. Still the nipple is above in 2, but still has a rounded appearance. The nipple starts to drop at the level of the crease in 3. And so that's that reference line. So I wanted to kind of give you that point of reference. I didn't do that in the beginning. I apologize. So what can you do for this? This little area is a little dicey. It's kind of gray. Certainly liposuction can occur. And we'll remove tissue. I'm going to say tissue, just breast tissue. We're going to put a negative sign there, so it means removal. But you got a little bit of component of loose skin too, so you can do this, and you may have some wrinkling of the skin that you might have to deal with after the fact. So it's really a tough decision sometimes for plastic surgeons of what is the right thing to do. Again, subsequent videos will focus specifically on this and what are the pros and cons to each treatment and what are the treatment dilemmas. So that's type 3. Type 4, draw this, and again, remember these are exaggerated, but I wanted to exaggerate it to get a point across, and I'm going to just go into my 4 there so you guys know. So as you can see, we've got the nipple that's way below the crease. We've actually got what it looks like to be a female breast. And again, most men do not want that. This is a type 4. And in that case, we definitely can lipo, I guess. You know, it depends. But really, we need to definitely remove tissue.
No, it's totally okay. I mean, I get it, and busy is good. We like that. We like busy, right?
Definitely remove tissue. And that's in the form of removal, skin and gland. Sometimes you have to remove not only the tissue, but you remove the nipple and then replace it at the right level. Again, this is a whole nother video about the right approach to the skin removal, whether it's at, you know, the type of incision, what you do with the nipple and the areolar, so on and so forth. But this is a really more complex treatment, but certainly a very doable treatment and yields a nice result. So the reason why I presented these 3 types for treatment is that the treatments are very different for the types, and you really have to know what you have and the best treatments that would work for that particular type. So when you go to your plastic surgeon, if you watch this video, you may have some idea based on where you are of what may be recommended. So, you know, preparation is key. It helps in understanding, and so that you're not kind of caught off guard if someone comes or a plastic surgeon recommends, you know, hey, I need to remove the nipple and put it back and remove skin. You know this because your presentation really kind of mandates that to get the best outcome. Again, this is our first installment. I hope you guys found this helpful. We'll do more. Look for these installments on my social media channels here on YouTube, Facebook, TikTok. I'll even probably at some point put this on my website, which is www.esjaesthetics.com. Talk to you soon. Hope you enjoy.